Convention. Welcome to the annual conventional rally. We normally would have it at Southport this year, or would have done, but due to the virus, we've had to make different arrangements. As a result, we are having this Zoom meeting today, one of 4 being held over the month of June. Just before we start, I would like to ask that we give 1 minute silence to the people that we lost since our last meeting, and also the many that we've lost as a result of the virus that's not only struck our country, but struck the world. 1 minute silence, please. Thank you. Talking about remembering, our previous national president, Frank Cooper, phoned the General Secretary last night and wished to be remembered to all of you. Sorry he couldn't be here. He's not Zoom trained, as they say it is. He's with many pensioners who are in the same position. But it was nice to think that he remembered the rally and only wished he could have been there. But his circumstances with his medical condition and obviously the effect of COVID has affected us all. So to start the proceedings, I think I would like to welcome you all. As I said earlier, it's a very constructive agenda, very good speakers. And obviously, as I said earlier, also, we are not able to meet face to face, but I'm sure we shall be able to carry on the good work that we've had over many years with such conventions. And clearly, time will help in as if people could put their questions in chat, and then we will deal with them as and when it's appropriate. So to carry on with the agenda, the health and the rights of older people have sadly for the wrong reasons been at the forefront of our minds over the past 18 months. Our speakers today are at the cutting edge of the battle to protect many of the NPC founding principles, to ensure every pensioner has the right to choice, dignity, independence, and security. First today, I would like to introduce the director of an organisation that is as we meet in the midst of a challenge close to our hearts of the NPC members. They are bidding to stop NHS Digital from a mass grab of all our personal health records from our GPs with little or no consultation. Please welcome Rosa Curlin and Corey Critter of Foxglove. Welcome. I don't know which one is going to speak first, to Rose.
Thank you very much. I think I will start and then pass to my colleague, Rosa, in due course. But it's an absolute pleasure and an honor to be speaking to all of you today. Rosa and I and my colleague Martha have started an organization called Foxglove, which has the general ambition to make the use of technology fair for everyone, younger people, older people, absolutely everyone. And it's been a real pleasure and an honor to talk to Jan and Bev and Jonathan and the people at the National Pensioners Convention about this issue and about the kind of experience of the NHS of older people in general. I mean, one of the things that Jan was explaining to us, for example, is that many of your members, maybe some of you on this Zoom call this morning, remember life before there was an NHS, before there was a national health service free at the point of delivery, and that everybody could come and expect to be treated equally and fairly and get a decent standard of care. You can hear by my accent, I am not originally from here. I'm from the United States. I'm a proud dual citizen of the US and the UK now. But of course, all of you know that that's still not how it is in America. And all kinds of people who are older, who are poor, are left to languish because we don't in America value this idea of a publicly treasured, centrally funded national health service. And what I think that we've come together with the National Pensioners Convention to try to defend in this case is a couple of things. But one of them is really, I think it really goes to the heart of the future of the NHS, which is it going to continue to be this incredible treasure free for everyone at the point of delivery? Or are we witnessing over time a slow process of privatization of parts of our assets? And again, all you have to do is look to your left at America to see that introducing those market incentives into the delivery of healthcare is totally the opposite of what actually produces good health outcomes. So what is the data grab? What's going on? Why does it matter? And what should you do about it? You could be forgiven for never having heard anything about it until now, because the government, the health department, and NHS Digital have done virtually nothing to promote it. On the 12th of May, on a very obscure government website, almost as if it was hidden at the bottom of the stairs behind a sign that says "Beware of the Leopard," there was an announcement saying that they were going to suddenly pool the patient data of all 55 million people in England into a central database. That is every man, every woman, and every child, their cradle to grave health record, everything that's in when you sit down and you talk to your GP was going to suddenly be pulled into a central database. They said that they wanted to do this for several reasons. They said they wanted to do it for planning, to kind of commission services, to improve the NHS, all of which, by the way, sounds great. And they also said they wanted to open up the possibility of doing research with that new unprecedented set of health data. Now, that was sort of what made us pause and think, well, hang on a minute, because I think lots of the people here would think, well, health research is great if it is used to improve the NHS, improve my care. We all, of course, want the NHS to come out of the pandemic stronger. But the real question was, who was going to be doing that research? Who was going to benefit? Was it going to be the NHS and patients, or was it going to be private companies for private profit? And there's been, I'm afraid, a worrying amount of slight hiding of the ball on the part of the NHS digital team and the health department about this, because they say on their website, if you, again, you won't have found it, but if they say on their website, we're not going to sell your data to insurance companies, but that's actually beside the point. It's not a question of whether a USB stick with everybody's health record on it goes over to insurance company. What they're talking about instead is potential commercialization of this giant asset of health data. And it's a very valuable asset. That's the important thing to understand. There are estimates that suggest that the value to the NHS of everybody's health data pooled together could be something like 10 billion quid a year. So who gets that benefit is the real question. Is it the NHS? Is it patients? Or is it large companies? And there in the fine print of the government website, it says, well, yes, there will be some commercial partners who are able to access it. They say non-insurance companies, but they do say, for example, that a drug company, a pharmaceutical company may be able to access it. And there are real questions, I think, around whether technology companies are going to be able to access it as well. This has been in the works for a while. In late 2019, there were closed door meetings between people like Dido Harding of the failed Test and Trace program, people at NHS Digital, and tech and pharma executives at places like Microsoft, Amazon, AstraZeneca, and others, talking together in a closed door setting about various commercial models for accessing this data. So they say they're not going to sell it, but it is going to be made available to other people for price and potentially for those companies to profit from. Nobody knows, almost nobody knows that this is happening. And that's what the case is really about. And in a moment, I'll hand over to Rosa so she can explain to you what we're doing to try to defend everybody's right to a say in this. But what we were concerned with is the government announced this collection. They then said, look, you've got 6 weeks to opt out if you don't want your full cradle to grave health record going into this centralized data store. So if you and your family think that this is not right for you, or you want more time to think about it, then you need to opt out before the 23rd of June, says the government. And that involves downloading a form from a website. We will drop a link into the chat so you can see it, and taking that form into your GP, which is, a very difficult way of going about this, and we think quite unfair in circumstances where many people aren't online, many people don't speak English, and won't have seen the website or know that they can download the form. We think that's totally exclusionary, maybe especially to the older generation who may, I'm glad that you guys are on this Zoom call, but some of your friends and relatives may not be. And so if you don't hear about it, and it goes into the central database and you miss the 23rd of June deadline, and you hear later and you kind of think, well, hang on a minute, I didn't consent to that. And actually, I don't want my health data potentially being used for Google to train its healthcare algorithms. It's too late. It's too late. It will have gone into the centralized database, and it will never be taken out. So we, the National Pensioners Convention, the Doctors Association UK, David Davis MP, and a host of other groups have been trying to raise the alarm about this and also take it to court to stop it. I'll hand over to Rosa in a minute to talk about what we're doing to try to pause the deadline. But the basic point is people need to know so that they can make an informed choice. There is no public health without public trust. And the way the government has gone about this has undermined trust rather than shored it up. And it's our health data. So it should be our choice, not just what happens to us, our health data individually, but we need a collective discussion about how we're going to dispose of this incredible asset, the nation's asset that is the collected health data of everybody in England. And with that, I'll hand over to Rosa, who can tell you what we're trying to do about it with the case.
Thanks very much, Rosa.
Thank you, Corey. So as Corey said, we have the real privilege of being able to work with not only your wonderful convention, but also David Davis MP, the Doctors Association, Open Democracy, and All the Citizens. And we have written to both NHS Digital and the Secretary of State to indicate the basis on which we think the scheme that Corey has just outlined is unlawful. And the UK has this wonderful mechanism called judicial review or public law claims, which is an extremely important way in which the government is held accountable and decisions taken by public bodies are scrutinised by the courts. So we have written indicating and notifying both defendants, NHS Digital and the Secretary of State, of the basis upon which we think the scheme is unlawful. And what judicial review process does is, assuming that both defendants don't concede the case, and I'll explain a little bit about the grounds of challenge that we put forward, what a judicial review claim does is it allows the court to consider whether the decision taken by the defendant and the procedures that they put in place to reach that decision are lawful. And if they aren't lawful, then the judicial review claim results in the court ordering the two defendants, in this case, NHS Digital and Secretary of State, to reconsider the decision. And in this case in particular, because of the crazy deadline that the government has put in place of this 23rd of June, as Corey was indicating, this is a case where we may need to, in fact, get an injunction to prevent that deadline remaining in force. So to explain a little bit about our arguments in the legal case, and just to summarise again exactly what we say and understand from what is a plethora of really quite complicated and unclear web pages and notifications. But what we understand is currently being proposed is that the collection of data will cover any living patient, child or adult, registered with a GP practice in England when the collection starts, i.e. the 1st of July, and anyone indeed who dies after the 1st of July. And it will cover all, a whole range of highly sensitive data, as Corey said, kind of from cradle to grave. So your entire medical history, and of course, the medical history that, for example, hospitals have also sent to your GP will also be covered. The data won't be anonymized, it'll be pseudonymized, and also it may be subject to re-identification in a range of circumstances. As Corey says, if you don't elect to opt out before the 23rd of June, the system will retain all the data collected up until that point. It will then be collected on a daily basis, and the data will go to NHS Digital. The point of the new scheme, the kind of purpose that it's been set up to achieve, is to permit the reuse of that data for a multiple of different purposes, some of which are not specified. And to be frank, no patient has hope of being able to identify them all. And in practice, members of the public have been given 6 weeks to discover the existence of this new scheme, a new scheme that the Secretary of State and NHS Digital decided to announce in the quietest way possible. And to be honest, if it hadn't been for all of these brilliant organisations that we're working with, I don't think there'll be so fewer people who would know about the scheme. So in the quietest way possible, they announced the scheme and gave the public less than 6 weeks to discover it, navigate and understand the complexities of the information that they've provided, decide whether they want to opt out, manage to in fact submit that opt-out, which, as Corey said, is not an easy process, all during a period when COVID restrictions are still in place. GP practices are trying to manage the COVID vaccination scheme and are totally at the moment they're completely over capacity. And all of that is supposed to be happening during this period of time with no properly informed consent being requested from either defendant. And what we say is it's completely clear under UK law that that process is not lawful. But when you're introducing a new automated mass nationwide daily data collection service like they have put forward, deliberately designed for multiple purposes, the public have to be informed about what's going on. They have to have a proper notification and explanation about what's being proposed. There needs to be a proper time period for people to understand and talk to their families and reach a decision of whether to opt out. And the current low-key online information about the service does not comply with the defendant's obligations. So as I said, we wrote to both defendants, setting all of those legal arguments out, asking them to confirm by the end of tomorrow, so Wednesday, that they will pause the scheme, that they will extend the 23rd of June deadline, and they will reconsider what proposals to put forward, and then to go through a proper public consultation process with everybody and all patients so people can properly consider what they want to do with their data. We don't know what they'll say. We're waiting for the letter to arrive by about 5 p.m. tomorrow. But assuming there isn't an agreement that the deadline is extended, then what we will be doing is rushing to court and seeking an injunction. Seeking an injunction to prevent the 23rd of June deadline remaining in force, and seeking an extension of that deadline pending our judicial review claim, where the lawfulness of the scheme will be considered and the court will determine whether it's lawful or not, or whether the Secretary of State should be ordered to pause and rethink before taking any further steps. And we will, of course, keep you posted, and I'm sure the convention will keep you posted about what comes back tomorrow evening. I'm going to hand back to Corey now, who has some further information about the opt-out and also about some crowdfunding in relation to the case.
There are three things I want to point out to you, and then we'll hand over to someone else and let some people ask some questions. But first, how do you opt out? I'm going to put into the chat a link to the website of Med Confidential that has a form you can use to opt out. I see that there are some questions around the kind of an online form on the NHS website, which has to do with the national data opt-out. I know this is confusing, but this is different. You need to fill in I know that's crazy. There are two opt-outs, but like take that one to one side. Actually, what you've got to do is fill in this form and take it to your GP. So I'm going to drop that in the chat, and I'm going to put in two other things. We have a petition in which we are trying to urge Matt Hancock to bin the 23rd June deadline, hold a proper consultation, and talk to people about what they want done with their health data and how we protect the value of this incredible asset that is the largest set of machine readable health data on the planet, as far as we know. So we'll send you the petition, and it would be wonderful if those of you who are online and engaged and at this webinar would sign it, share it with your friends, so that we can really kind of send a message to Matt Hancock. And then the third point is he may cave. Matt Hancock may cave, and he may extend the deadline and let us all have this debate in a proper, timely way, but he may not. We know that NHS Digital apparently want to wait and give people more time, but the health department haven't said that. And at the minute, if they don't, to protect everybody's right to have a say, as Rosa said, we've got to take them to court urgently. Now, that means that we've got to protect the National Pensioners Convention and everybody else from having to pay the government's legal costs. So we've got a crowdfunder, which you can, if you and your friends feel able, you can chip in a $5 or a $10 just to support our ability to buy everybody more time and to go and take this to court without all of the nonprofits who are standing up for you having to run the risk of paying for the government's lawyers. Then that will be brilliant. So that's three things. Again, I'm going to send you a link to the opt-out form, to our petition, and to a crowdfunder. And if you could look at them, fill in the form if you want, sign, share, and chip in whatever you could afford, we would be so grateful. Thank you so much for having us.
Thanks very much. Very good presentation. And obviously you are aware of the NPC support in that petition. We're going to move on to the second speaker now because they need to leave. So the early days of COVID pandemic highlighted undoubtedly against ageism across the sector of society. You only have to look at the decisions taken to apply do not resuscitate older and elderly patients without consent, for an example. Age is a characteristic of equality. And in 2010, and we are delighted to welcome Jackie Keelan of the EHRC to tell us about what the actual means and how we can enact the law to protect us from ageism. Welcome to Jackie.
Thank you very much, Ron. Hello, everybody. Very nice to be with you virtually. I very much enjoyed taking part in the last NPC convention. I think last December it was, and I'm only sorry that we're still not getting to do these things in person. As Ron said, my name is Jackie Keelan. I'm the Director of Compliance at the Equality and Human Rights Commission. Ron, what you said when you reminded everybody about the NPC's values of choice, dignity, independence and security resonated very strongly with me. I was pleased to hear those mentioned this morning. So the Equality and Human Rights Commission is Great Britain's national equality body, and we've been awarded an A status as a national human rights institution by the United Nations, and our responsibility is to try to uphold equality and human rights legislation here in Britain. Our job is also to try and make Britain fairer, and we do this in a number of ways: by advising governments, by providing guidance to businesses, other kinds of organizations, people who have, duties under the legislation, and by enforcing equality and human rights law, sometimes taking that action when things have gone wrong. We use, for example, our litigation powers to take or get involved in strategic cases that will strengthen equality and human rights law and drive improvements in practice within organizations and within wider society. Rosa and Corey just mentioned judicial review. We recently brought a judicial review against a health board and a chain of care homes in Scotland to stop them from transferring patients who were medically fit but didn't have capacity. They were being transferred without consent or lawful authority into care homes from hospital. So we took a judicial review to prevent this happening. So that's one example of the kind of intervention we can take. We also undertake statutory inquiries into issues that affect people's lives. We do that with an aim of making evidence-based recommendations that lead to changes and improvements for the better. We know that fairness is a sort of bedrock value, and we strive to help achieve a society in which everyone can achieve their potential and where people treat each other with dignity and respect, going back to Ron's points. Jonathan is kindly managing some slides with me, so if you could go on to the next one, please, Jonathan. Yeah, the next one down again. Thank you. I'm going to talk a little bit about the current situation here in terms of equality and human rights and older people, and also about that framework of legislation that's there to protect us. So nobody needs me to tell you what a profound and catastrophic impact the last 15 months or so have had on all of us, but particularly certain groups within our society who've been disproportionately affected. And that includes very much older people. Coronavirus has raised very important questions about how, as a society, we value older people's lives and rights. And the effects of the pandemic on older people who live in care homes has been particularly devastating. As a commission, we have repeatedly drawn attention to potential breaches of human rights, as there is evidence that equality and human rights standards haven't been consistently upheld during the pandemic, including the rights to life and health, the right to a private and family life, the right to freedom from ill treatment, and the right for disabled people to live independently. So in the autumn, we produced two significant reports on the impact of the pandemic. Our first report, which was called How Coronavirus Has Affected Equality and Human Rights, brought together all of the emerging evidence at that time on those areas of life most affected. And then we published a separate briefing specifically on equality and human rights in care home settings. And in that, we recommended urgent action by the government, by regulators, by local authorities, and by care providers to put equality and human rights at the heart of their COVID response. And we have followed up on those throughout the ensuing months. We warned that the pandemic has been unequal and that it has entrenched existing inequalities, but also widened and led to additional inequalities. Older people have been deeply affected, experiencing a higher risk of mortality, the threats to their freedoms that I mentioned already, and a level of loneliness and social isolation that's probably been unprecedented. Older people have been less likely to leave their homes during the pandemic and have been more likely to have been either advised or required to shield. And for example, by this May, following the easing of lockdown restrictions for many of us, 8% of people aged 70 or over reported not having left their home at all. That's 8%. and 26% had either stayed at home and only left for a limited number of reasons, such as medical needs or essential shopping. And this has been compounded by digital exclusion. Ron, I know you've mentioned this already. Whereas we have all been socially isolated during the pandemic, for those who can't or don't have access to the internet or familiarity with digital platforms, there's been a significantly greater level of isolation, and we're concerned to see, a greater reliance on digital means as the default means for accessing services, and we're concerned about the impact that will have on people who don't have that access. Those who live in care homes have really faced very significant isolation due to restrictions on visits from family members, and we know this has resulted in deterioration in both mental and physical health. There's also been an impact on older people in the workplace. Age discrimination claims made to employment tribunals increased by 74% in 2020, and redundancies among the over 50s increased by 79%, which are really significant figures. So in response, at the start of the year, we produced guidance for employers to remind them of their legal obligations to ensure that they do not directly discriminate against employees with protected characteristics when making decisions in response to the pandemic, in particular, and including older people and disabled people. And we have reminded them of these throughout. In addition to this, another concern that was flagged to us was around the ability of older and disabled people to access food and essential services. So we took urgent action to remind all retailers of their responsibilities to make reasonable adjustments and ensure that people can access essential goods and services. We produced guidance for them that we know a number of retailers have used in their staff training, and we're keeping a very watchful eye on this. I know concern about ageism and what the pandemic has done to perceptions of older people is a real concern, and we share that. In March, the World Health Organization published a global report on ageism, and this found that ageism in societies leads to poorer health, social isolation, and earlier deaths, and costs economies billions. The report found that the response to the pandemic has unveiled just how widespread ageism is, with older people having been stereotyped in public discourse and on social media. I think we've seen older people treated or viewed or presented as a sort of homogenous group who are frail and vulnerable, and they are a problem to be managed rather than equal contributors of equal value to society. And we don't want this perception to take hold more broadly. So we are continuing to raise these issues, and in particular to push for equality and human rights to be upheld in social care. I wanted to note that we're currently preparing to undertake a new inquiry into adult social care to see whether and the extent to which social care upholds equality and human rights standards. So we will be very keen to get to take as much evidence on that as possible, and we'll be gathering evidence from people with experiencing of accessing care, and probably in particular the decisions around how social care is made available. So we'll be sharing that link with the convention when the inquiry goes live in the coming weeks, and would welcome responses from colleagues on this call. Jonathan, would you mind moving to the next slide, please? I thought this was a good opportunity to highlight the right to independent living in particular. So the UK government is signed up to international treaties which set out commitments to protect and promote human rights. And one of these treaties is the UN Convention of the Rights of Persons with Disabilities. This is known as the CRPD. The CRPD says that disabled people have the right to live independently as part of the community, but this right isn't yet fully reflected in UK law. We've recently, just a few weeks ago, published a briefing with extensive recommendations for the government on how they should embed this right into domestic law here. And while the right to independent living in the CRPD is particularly about disabled people, it's important that we look at the intersection, so the crossover between disability and age. So we know that 46% of state pension age adults are disabled, compared to 22% across all age groups. Many older people will be living with, for example, mobility impairments or chronic illnesses, and some non-disabled older adults also experience similar barriers to living independently as part of the community. We've sought to highlight this throughout the paper.
I shall have a break at 12.
It's important that all people have choice and control over the decisions affecting their lives on an equal basis with others. And so we think that implementing our recommendations on the CRPD would go a very long way to strengthening the rights of older people as well as disabled people of all ages. And as we emerge from the pandemic, we think this is the right time to look to embedding these, and we're hoping that the government will take these recommendations forward. Jonathan, could you move to the next slide, please? So I wanted to talk, because colleagues at the convention asked me to talk in particular about the legal framework of protections. And the first important part of that is the Human Rights Act. This is legislation that protects us all. And I want to say a little bit about what you can do if you think your rights have been breached. So the Human Rights Act, which came into effect in 1998, sets out our fundamental rights and freedoms, and that everyone in the UK is entitled to. It incorporates the rights set out in the European Convention on Human Rights into British law. The Act sets out your rights in a series of articles, and each article deals with a different right. Now, you can access all of these on our website, but you're probably aware of many of them. They include the right to life, the right to liberty and security, the right to respect for your private life and your family life. And we all have a right to enjoy these freedoms and protections without discrimination, including on the basis of age. The Act has three main effects. So first, public bodies must respect your rights. Second, new laws must be compatible with the Convention rights. And third, you can seek justice in a court of law in British courts if your rights are breached. The obvious way to challenge a breach or a potential breach of your human rights is to bring a case to court, but that can be expensive and time-consuming and may not give you the remedy that you need in the short term, particularly if it's an urgent issue. Many complaints about human rights in Britain never actually reach a court, because some public authorities can and do respond positively when asked to review their decisions or actions in light of their responsibilities under the Act. So we would say that it's often best to explore other options before considering legal action. There are informal and formal methods that give a public authority the chance to improve the way that they treat you. But don't forget, whatever action you take, it's best to do it early. If you do have to rely on legal action at some point, there are strict time limits on doing this. So you may find that you can resolve the issue with an informal complaint. This could be on the telephone or a face-to-face conversation, but it's a good idea to be as specific as you can in this conversation, to keep a record of it and to make a note of the date, and then to follow that up with a letter recording what was discussed, because you may need to come back to that. If an informal approach doesn't work, you can make a formal complaint. Most public authorities have their own complaints procedures and they're obliged to make those public. If there is one, you should usually follow it. And then if you don't get satisfaction, then you may also be able to complain to a regulator. For example, the local government and social care ombudsman or the Parliamentary and Health Service ombudsman. So those are just some of the options. Jonathan, if you could move on, I'll move now to the Equality Act and age discrimination. So the other major piece of legislation which protects us all is the Equality Act. It's now over a decade since the Act came into force, and it offers comprehensive protection for all of us against discrimination, harassment, and victimization. The Act strengthened and extended protections for minority groups, and it unified a range of anti-discrimination laws into one place. In fact, it brought together over 116, I believe, separate pieces of legislation into one Act, aiming to bring clarity for us all on the protections that we can expect when at work, when in education, accessing services, taking transport, and really just living our day-to-day lives. The Act aims to offer us all protection from discrimination on the grounds of 9 different protected characteristics, and they are age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex and sexual orientation. And all of us have at least 4 of these characteristics. The Equality Act says that you must not be discriminated against because you are or are not a certain age or in a certain age group, or because someone thinks you are or are not in a certain age group. This is known as discrimination by perception, or because you are connected to someone of a specific age or age group. And this is known as discrimination by association. So it tries to be as specific as possible. I should note, however, that discriminating against someone because of their age is permitted if it can be objectively justified. So, for example, if belonging to a particular age group is essential for a job. One example I saw was a film company making a film of Oliver Twist. They may lawfully hire a young boy to play the role of Oliver. It's also justified if an organisation is taking positive action to encourage or develop people in an age group that is underrepresented or disadvantaged, and they're trying to get more representation from that group in a role or in an activity. And there are exceptions to the Equality Act that allow organisations to provide different treatment in employment or services based on age. I really want to say that that's not to say that you can't challenge age discrimination, because you can. And just a few months ago, we signed a legal agreement with the Department of Work and Pensions to improve their employment practices after it was found that they had discriminated against one of their employees because of her age and her race. So I would say that these are important protections, and the more that people are aware of their rights, and the more that duty bearers are aware of and required to fulfill their responsibilities, then the more likely that we all are to enjoy and experience fair treatment. And this seems the time to be making sure that we are making those calls loud and clear. You'll find a lot more information on both the Equality Act and the Human Rights Act, as well as how you can challenge potential breaches or discrimination on our website. And Jonathan, if you just move on to the final slide, you can see where our website should be up there. It's www.equalityhumanrights.com. There is also something called the Equality Advisory and Support Service, which is a helpline, and they can give you advice on that helpline. That number is also on our website. It's not just a phone, they also have a live chat function and other accessible contact methods such as text phone and BSL. So hopefully that is accessible to everybody. Ron, that's all I have this morning. I hope that wasn't too much of a canter through. Thank you very much for having me. That's me finished.
Thank you, Jackie. Very comprehensive report. And I'll ask Jan now to ask the questions of the speakers today. Jan?
Yeah, just for Jackie at the moment, but there are questions I think coming up that yourself and Rosa and Corey could probably answer too. One of the major policies for the NPC, Jackie, is a commissioner for older people in England. With judicial powers and independence like those in Northern Ireland and Wales. I mean, would you agree that, and obviously that needs to be backed up by legislation that protects older people, you know, in total. Would you agree that that is something, we know it's difficult, but would you agree that is something, if we could actually get a commissioner for older people in England, would actually give older people a voice? We have no parliamentary voice, even though we contact, you know, ministers and parliamentarians on peace. So if you could answer that question first, and then maybe come to the other questions that both you and Corey and Rosa can answer.
Thanks, Jan. I mean, I would say, first of all, that you do a tremendous job in raising concerns and advocating, and we're you know, pleased to work with you and with other older people's organisations to try and do that. And I would say that we work very closely with the Older People's Commissioner in Wales, and you know, have been working a lot, for example, around the social care inquiry that I mentioned, which we will be launching, I hope, in the next few weeks. So you know, if if there were changes to bring that about in England, we would work with the commissioner in that post as well. We work with the Children's Commissioner and those offices across the three nations. I would say that in the meantime, you can hopefully count on us as a reliable ally to make sure that all of these concerns are highlighted, and that we're taking the action that is possible under existing legislation to make sure that things improve or are redressed where that can happen.
Yeah, thank you. Well, maybe this one is for you as well, and Corey and Rosa, you can make a comment as well, because I think the three of you are across that area of discrimination. And when you look at age, and we already know in the NPC that 67% of older people are not connected digitally, yeah? And we've had someone put a question in the chat. His son's GP practice is only going to take documentation that has been electronically scanned and emailed. Yeah. So if you look at an older person, I can do it. Yeah. An older person may have a computer, may be able to print off the opt-out form, fill it in by hand and post it to the GP. What they might not be able to do, they might not even have a scanner. It may just be, an iPhone. And even if they have a scanner, they might not know how to use it. So to me, that is another layer of discrimination against older people who do not have technology, or if they do, cannot use it to its fullest extent. So how could we challenge that GP? How could our member challenge his GP and say, actually, no, we will download a form, we will fill it in, and we will bring it to the surgery or post it to the surgery. Now, my guess is, as Rosa so clearly put it in her speech, this is coming at a time when GPs are just reopening face-to-face consultations, and they're having to make their surgeries COVID safe. It's cost them money, and they won't be able to see the amount of patients in a day that they would normally expect to see. So on the one hand, you can see why they're actually wanting to do that. But on the other hand, there's this lack of understanding and interest in their own patients getting that form to them. So I'll come to Rosa or Corey first, whoever wants to answer that question, and Jackie, you can come in behind that, yeah? So Rosa or Corey, who wants to kind of make a response to that? Corey, are you?
Okay, so
yeah.
it's slightly hard to communicate over video with each other.
Is, I know.
Apologies. So so Corey, please do add on anything else that I failed to say. I think this puts GPs in an incredibly difficult position, what the government is doing in relation to data. And certainly we are aware that many GPs actually feel that they have legal obligations to their patients in terms of confidentiality, which makes them feel actually very uncomfortable with the idea that they're supposed to be kind of part of this scheme and supposed to be handing over data from the 1st of July onwards in a way that they don't feel is in compliance with their duties of confidence and kind of patient trust that is so crucial to our National Health Service and public health more generally. We're aware there's been a couple of, there's been, for example, a public letter written by one GP kind of calling out these problems. There's also been a kind of collective, a group of different GP surgeries who've come together to say they don't want to implement what the government is saying to them. And I think from our perspective, this should very much be, this is about the Department of Health, and this is about NHS Digital, and the obligations are on them as public bodies, and to try and shift focus onto GPs and get GPs in all sorts of kind of very difficult moral and ethical and indeed possibly like kind of lawful questions is incredibly unfair. And you can kind of imagine, we spoke to one GP, Corey and I recently, who was saying, I can already see the government trying to blame us for not doing proper kind of notifications. You know, I can already kind of predict all of that happening and how unfair that is, particularly in the context of a pandemic, and the fact that it's NHS Digital and the Secretary of State who've made the decision to implement this scheme at this point, you know, with all the restrictions and the vaccination programme and the backlog of different kind of health treatments that are currently in place. So I think from a kind of foxglove and from the case's perspective, our view is this is really about the Secretary of State and this is really about NHS Digital, and their attempt to shift focus to the GPs is kind of unfair, to be honest. Having said that, kind of in a more general sense, from a kind of public law perspective, clearly, you know, GPs have the same obligations in terms of the Equality Act and access, and they need to make whatever reasonable adjustments are required in order to make sure that all members of, you know, all their patients, all their potential patients, the people, you know, whose health they kind of supervise and take care of in their areas, they obviously need to make sure that all of their services are truly accessible to everybody, and that is a very clear duty under the Equality Act. Corey, did you want to add anything else to that?
No, I would say that's comprehensive.
Thank you. So Jackie, when we talk about digital exclusion in the NPC, we talk about it in lots of ways. There are different levels at which older people are excluded because they're not connected to technology, or they only use email for certain things. They don't buy online, they don't consult online, they don't know how to. So with all the drive to everything going online, you know, Milk and More dumping their older age customers who've actually been loyal to them for the last 30 years in favour of online purchasing only, consultations, and this one particularly, it is reopened the fact that this could actually be a government scam if you look at it, you know, in terms of the collection of data and not telling anybody. But at the end of the day, does that actually amount to discrimination? Because I know it's quite complex in terms of how you do your cases, yeah.
So I think that's probably kind of too big to we would probably need to break that down into kind of individual scenarios. I think at a sort of national level, we are concerned about the trends. You know, we understand we understand that people have to balance what we call duty bearers, so public bodies, including GPs and people who provide services, have to balance all the time, but particularly during the pandemic, they have to balance rights and responsibilities. They have to balance considerations about making sure that, you know, they're protecting, let's say, their staff by maintaining COVID security, and while also trying to make sure that they're providing fair access. So we do understand that, but we have asked all public authorities throughout the pandemic to make sure that they are undertaking equality impact assessments of any emergency measures that they're putting in place. And we would want to see that happen for any new measures around how services are delivered or how people's rights to participation are accessed, even beyond the current scenario. We think when any new policy, when any new practice is being considered or being developed, we want to see that a full consideration of the equality impact and the potential quality impact individually and cumulatively has been undertaken by whether that's at a national level, at a local government level, or at an individual service provider level. We need to see that happen, and that's what the public sector equality duty, which is part of the legislation, requires them to do. And we can take action where we feel that there is evidence that hasn't occurred. With digital exclusion, I think it is quite a complex picture, because we do see that trend kind of going in that direction, and there is a need to both make sure that all people, including older people, are included where possible, and given the access that, or able to access things that are might be beneficial in some ways, because we can all participate in this way. But are not left behind because they can't have that access. And I suppose that might change over time, but we are concerned that gap for those who are already excluded might widen over time. So we've highlighted this at a kind of policy level, but we continue to request it of people who are making policies or introducing practices or services, that they do that. It is a core tenet of the legislation, and it's good practice to do that upfront.
Yeah,
and to monitor what has happened. So they should also be monitoring. Apologies, that is my old school landline ringing in the background, if you can hear it.
That's okay.
It's also good practice that they monitor what has happened as a result of any new changes that they've implemented, so that they can understand whether people have been excluded from those services if, for example, they have moved to a digital by default service delivery. So they need to be monitoring that, as well as thinking about it up front before they implement it.
Yeah, I think, it's difficult, because I think there are so many kind of fires being set at the moment, and we're one organisation with a set of resources. So it's really looking at how we can, work with people like Corey and Rosa and like yourself to kind of keep us straight, but also make sure that what we're doing, is right and proper, and also for the benefit of older people, not right now, but in the future, because if someone maybe 50 plus is quite digitally minded at the moment, as you get older, sometimes you do not become digitally minded and you want to get rid of it. You're fed up of new packages, you can't understand them, whatever. And there should be no assumption that because that age group of people are totally digitalized and it works for them, that will work for them when they're 60, 70, 80. And to take those accesses away now, the alternative access of telephone, writing, a face-to-face consultation, just being able to read something and respond to it as you would normally. And to take that away now is creating a huge exclusion zone for the future. So we're not just about today's pensioners, we're about the next generations, as Gail will hopefully tell you later. But I'm keen that you've got to leave, Jackie. So thank you so much for your input. If anything comes up, we'll write to you. Okay, thank you.
Very happy to answer any future questions. Thanks very much for having me, Jan and Ron. Enjoy the rest of the convention. Bye-bye.
Thanks, Jackie. All the best. Thank you. Is there any further questions at this stage?
I'll keep them for a little bit later, Ron, if you
Okay, thank you. So we move on to the agenda. Item 6, introducing Gail Cartmale, President of TUC. The NPC was established some years ago by the trade union Jack Jones to campaign on behalf of pensioners. Since then, the trade unions have recognised the importance of organisation and campaigning older people's rights. So we are privileged to welcome Gail Cartmale, President of TUC, to the 2021 Annual Conventional Rally. Gail, Assistant General Secretary at Unite the Union, the UK and Ireland's biggest union. She is Unite's strategy lead for a number of key sectors within the union, the TUC spokeswoman for international development, and a member of the Labour Party National Policy Forum. It is my pleasure to invite Gail to address the rally. Thank you.
Well, thanks so much, Ron. And actually, it's my privilege. I'm delighted to be with you today. So thank you for this opportunity. And I've just come from the Unite Executive Committee, and where we've been talking about access to technology poverty, and the importance of libraries. And our librarian members have established a library forum. And I know that that's an issue that NPC and Unite share an interest in, keeping libraries open, accessible to the whole community, staffed by the appropriate level of professional librarians. So I was really interested to hear what was being talked about. Look, I'm going to start with a personal note, if you don't mind. I left school at 15 and I've worked all my life. I'm a so-called baby boom generation person, and benefited massively from that post-war optimism. You know, my family were moved from a slum into a council house. I only ever knew a council house, a decent home for rent, accountable to a council. We had, of course, the National Health Service, and as a postie, you know, after a couple of strikes, my dad got a reasonable whack and had, you know, a reasonable post office pension. And we also had a social security system, which was a social floor beneath which nobody would fall in hard times. I myself was unemployed and claimed unemployment benefit and was supported back into work. And at age 15, my state pension age, Ron, was 60. Well, in April this year, I was 66 and have now qualified for my state pension. And 6 years out of the original 60 is quite a chunk, isn't it? It's quite a percentage. And, you know, I remember somebody, I think probably my mum, saying, oh, well, you know, you'll get your pension, and thinking, oh, God, you know, I'll be dead by the time I'm 60. Because, you know, when you're young, you just don't think in those things. But what a flipping cheek. The idea that those behind us will have to work even longer. A state pension, in my mind, is unconscionable. The least we should do is to hand on to the generations behind us a better share of our wealth, not less. So I hope you don't mind me indulging in that little trip down memory lane. And by the way, I was brought up properly, Ron. I was brought up to respect my elders and to have a deep respect for pensioners in our communities who, through their tax, paid for our National Health Service and Social Security system. And I'd like to see that deep respect continue, particularly as I am now a pensioner myself. So moving on, if I may, at the core of our movements, and I speak of movements in plural, our trade union movement and our National Pensioners Convention movement, at the core, we have an aim, we have a shared aim, which is universal right to a dignified and secure retirement. And it is my view, as I've just touched on, that that is as important, if not more important, today than ever before. So in this brief presentation, I'm just going to touch on the mutual support between our organisations and our priorities on pensions and social care. Just to start by saying, Jan did you proud, did us all proud in her presentation to the TUC Executive Committee on behalf of the NPC. She made a briefing, and it's you're making a briefing to people that from time to time they appear to think they know it all. And I know that in your briefing, Jan, you certainly educated everybody, and we're all in the same place now in terms of some of the detail of policy that the NPC looks at and the reasons behind your campaign priorities. So I thought that that briefing to the TUC Executive Committee really set out the grounds for future cooperation. So thank you so much for that. I'm just going to turn, if I may, to some priorities. So the other issues of mutual support. You've already mentioned, Ron, the founding member of the NPC, Jack Jones, a legend in his time. And of course, I can boast that he was a General Secretary of one of our unions in Unite, so we claim him. And, you know, what a terrific start in terms of a collaboration between the trade union movement and the NPC. And as you know, many unions affiliate and are proud to affiliate to the NPC and provide additional support and resources, particularly at local level. And what I would say about that, by the way, is if you don't ask, you don't get. So please keep coming with practical suggestions for support that you need as an NPC to bolster your work and profile. We campaign, lobby on shared issues, for example, support for the state pension triple lock, universal entitlements like the TV licenses and winter fuel payments, of course, defending public transport and fixing social care. And what a disgrace that in the recent Queen's speech, despite the promises of Boris Johnson, Prime Minister, not a dicky bird about social care. It's a broken system. It should be a national service with parity of esteem with the National Health Service to promote independent living, and we're with you on that. And we're appreciative of the support you've shown for our campaigns and the struggles of individual unions. I've just got a few examples here, but it means so much to the workers. So the Birmingham and Bristol care workers strike, where NPC gave great support. RMT campaign for guards on trains, massively significant. And the PCS disputes over pay and conditions. And of course, the TUC anti-austerity campaigns. And you're with us on our marches for the NHS. You're with the GMB on the Keep Cash campaign, and you're with them on the anti-privatisation of post office. We haven't won all of our campaigns, but that doesn't mean to say we're not going to continue to fight and to reverse the losses that we've experienced. We exchange speakers on platforms, and today's an example of that. And together, I hope we attempt to pit one generation against another. I think that's really important. At the moment, we're seeing an exponential increase in the number of age-related dismissal discrimination cases before employment tribunals. And the precarious nature of employment for young workers goes hand in glove. The issues are in detail perhaps different, but the outcomes are the same. So tackling intergenerational income inequalities is really important. Now, union priorities on pensions, they include a recognition that the current state pension is inadequate and lower than most comparable countries. And you know, not a lot of people really are alert to that. So the work that the NPC does to educate and inform on that issue, as well as the work we do, is really important. I've mentioned pensioner poverty, and I overheard that being referenced in a previous discussion. But the rising of pensioner poverty since the mid-90s is really concerning, very concerning indeed. And that is something we need to work together to reverse. And inequalities, we know, particularly worrying, poverty rates are far higher among older single and BME pensioners, and the trade union prospect highlights annually that female pensioners, women, income have around is around 40% lower than men. You know, a continuation of the gender discrimination that my mother and generations after her have shouldered. So we've argued, as I know I've said, consistently in support of the triple lock. And you will have talked about the benefits of that having brought 700,000 more pensioners below the poverty, the impact of removing the triple lock will bring into poverty below the threshold 700,000 more pensioners. Forgive me for misspeaking. My union, I'm going to blow my union's trumpet, is a bit more ambitious than TUC. We're calling for an immediate increase to the state pension for a single person to £200 a week and £350 for a couple. And the TUC is working on a 10-year plan to achieve a retirement pension of 50%. Well, that was our motion to last year's Congress, and it's our job to try and get that debated and acted on. We're calling on government to measure and report on the pensions gender gap. We're calling for more low-paid women to have access to workplace pensions. We're calling for action to close the gender pay gap on improving childcare options, to allow more women to work, and we're lobbying government to address the underpayment scandal that was revealed in the last year that affects 250,000 mostly older women pensioners. I mean, you couldn't make that up, could you? 250,000 people shortchanged. It's incredible. It is a national scandal. And we've argued for a freeze on planned state pension age increases, including producing research that highlights the number of people who are already too sick to work before they reach state pension age. I'm stumbling on this because some of the statistics that we share in respect to the injustices that pensioners are suffering are staggering. And I look to check that the comma is in the right place. 250,000 mostly older women pensioners that I mentioned earlier, shortchanged, and this disproportionate impact on working class and BME workers in less wealthy regions. These are huge numbers of people being disadvantaged. Union priorities in social care. I'll conclude with this. Union priorities include, as I mentioned earlier, the long-term goal, which is universal service, free at the point of use, and it's the same position, Ron and Jan and everybody in your audience, as the NPC. Nothing more, nothing less. It's absolutely crystal clear and must be delivered. And our immediate asks are reverse funding cuts, fill the 120,000 social care vacancies, and by the way, paying a minimum £10 an hour, ending 0-hour contracts, setting up a national social care forum, and reducing, and I would argue, by the way, eliminating the role of the private sector. It's a broken model, it can't work. Government needs to give councils more money to resource properly the sort of care service that we expect. I'm doing that thing where somebody says in conclusion and then they say something else. This is my conclusion. I was just thinking about Jack Jones, your founder. And I was just thinking about how he was described by a former General Secretary of Amicus, Joint General Secretary of the TNGWU, my good friend Tony Woodley. And he said, Jack Jones was a fearless champion, standing up and fighting back for justice. And I think that's really our job. You know, he's with us in spirit, I know, wherever your beliefs lay as to where he may be. He's with us. That sentiment of standing up and fighting back for justice is something that I know the TUC and my own union is committed to doing with you, the NPC. I thank you for all the work that you do, and I hope I haven't overstayed my welcome. So
No, very good of you, Jan. Thanks very much for the comprehensive report. Jan, is there any questions in the chat?
Can I just go? I don't know if is Corey still here or is it Rosa?
Corey.
Yeah, we're both still here. Hi there.
You're both very busy, and I think Gail will forgive me for putting you first because you need to get on with the work that you do. I just want to recap on the issue of GP. Yeah. To maybe we're going to obviously do some work after this on a press release, and we want to make sure that people do understand around the GP responsibility, because if GPs are not au fait with what's happening, or they are and they feel that it's just too much imposition on their practice, those people who want to opt out and make sure they've opted out by the 23rd of June, how can we help them to get through that kind of red tape or mishmash of confusion?
So the easiest thing that they can do in terms of cutting through the red, do you mean helping GPs or do you mean helping people who want to opt out? Sorry, I want to make sure I've understood the question.
Well, I think if we've got a problem with GPs either not knowing about the opt-out, there's been a few messages saying that the GP, when they took the opt-out form, hadn't got a clue what it was about. Yeah. So we've got GPs that may not know that opt-out is coming their way. GPs may know, but want to use the scan process and exclude people who's not digitized, or there'll be a problem getting information to GPs by the 23rd of June. So it's really that confusion and how we can put people's heads right and say, this is what we should do. Yeah, see what I'm saying? It's kind of, it's very confusing and complex, and I think that's the way we find the government works at this moment in time. It suits them.
From the perspective of the patient, filling in the form and taking it to your GP legally protects you. The government is required to honor your opt-out. Then when it comes to the GPs, one of the reasons, of course, that we're working with a doctors association as well as all of you and bringing this case to try to get more time is precisely the problems and the chaos that you've just described, which is that many GPs don't understand what's happening. I mean, I've seen some really bizarre stuff on social media where GPs are telling people to kind of go away. I mean, which is not right? I mean, they're actually legally required to accept your opt-out form and to submit it if it comes in before the 23rd June deadline. So the GPs, I mean, there is going to have to be an extended effort, you know, not just on your part, but actually just generally to inform GPs about what's happening. I have to say, shocking that NHS Digital and the Department of Health didn't do their job. But it just goes to show you why actually what needs to happen is the scheme needs to be paused. But just so you know, the British Medical Association and the Royal College of General Practitioners have already said to the government, this is being rushed and it needs to be stopped. So I would hope that GPs, if they're paying a little bit of attention to the general discussion about this stuff, will see that there's something happening, that time is running out, and that they need to inform people. But in general, if you're a patient and you're concerned about this, the two things that you can do that are likeliest to protect you, really, I would say, are fill in your opt-out form and support us in whatever way you can, either by the petition or the crowd justice, so that we can slow this process and buy everybody more time to have a proper, informed, reflective debate about the future of what happens with this country's health data.
Thank you. Thank you, Corey. Thank you so much for your time, and Rosa's too. And we'll be talking to you, I'm sure, later. We'll give the plug at the end when I do my roundup bit. So thank you very much. Bye-bye.
Pleasure to talk to you all.
Thank you for having us.
Thank you. Bye. Bye.
Gail. Gail still with us? Yeah.
I'm here, Jan, yes.
Right, okay. Thank you for your beautiful speech, and thank you for your praise for the NPC. It is absolutely greatly appreciated. We don't often come in for that much praise, as you know. It's par for the course when you campaign against things people don't like you doing. I think for us, it is absolutely brilliant to know that the TUC, particularly on pensions, I mean, our policy is a decent state pension for everyone, yeah, which is 70% of the national living wage, uprated by the triple lock. We have got a kind of a space in between, if you like, because we know that arguing for 200 and odd quid a week from, you know, my kind of state pension, which is 134, people are going to go running and hide in cupboards. So we did come up with something that might be a step in between, and I'll mention it here because I think it might be an idea to take back to the TUC and to Unite. What we'd be looking for, so say next April, when the pension increase comes around, if it is 2.5%, then what we would argue is that 2.5% in monetary terms, which is applied to those people who get a full state pension. So say, for argument's sake, the 2.5% next year means £5 a week on a state pension where somebody's getting the full amount. What we would argue for is that £5 a week goes across the board. That starts to bring particularly women, the older age group of women, a little bit up, and can be afforded. If you look at what this government makes, and we'll be doing a presentation about that, or Bob will, on the 18th of June in the pension session. If you look at what the government actually saves, but also makes on 1 year of one person not retiring, right? It is ridiculous to say that this country cannot afford a decent state pension. Yeah, so that's where we're moving to at the moment. It's kind of like a step in between to lever it up. I don't know what you think about that, Gail.
Well, I think it's you know, Jan, the ingenuity of NPC, I think, is great. And you know, trade unions will recognise that approach because, as you know, when we negotiate, particularly in the public sector, where people are bumping along at the bottom of the pay spines, what we sometimes come up with is a formula whereby we say X amount or X percent, whichever is the greatest. And that's lifted lower paid workers out of minimum pay, to be blunt, onto living wage. So it's an approach that will be very, very, very familiar, Jan and Ron, to trade unionists. I mean, and therefore, and I think the trick here is that it's crystal clear this isn't an interim position. This isn't giving up the ghost, and that you've done your homework. Somebody on your chat, I think, or Q&A said, hang on a minute, you know, we've all paid in via NIC. We've all paid in. And as I mentioned in my opening, and you mentioned in your briefing to the executive committee, our pensions in this country are lower than most. So such a proposal seems to me to be very modest, and it's worked out. And I can't make policy for the TUC just because I'm president, unfortunately.
Yeah, no.
But I think it would have a soft landing as an idea, definitely.
I think that's where we thought, you know, something achievable if you have the right mindset of the people that you're talking to, like your Minister of Pensions and, you know, the DWP. So that was good. And I think, you know, again, you mentioned the increases in state pension, and there's a question in the chat saying, should we not campaign to go back to 60. Well, that's one of the things that perhaps will come about in our pension session on the 18th of June. I know Jack's got a report that he did on older workers and how they're badly affected and impacted on by being sick and being expected to work, or if they are made redundant or lose their job for another reason through ill health, they then go on the merry-go-round of universal credit. You know, nobody's going to employ them at 62, 63, 64, and with ill health. And they're on that merry-go-round of universal credit, which at their time of life is something that they would not expect. Whether we can actually, our drive would be to take it back to 65 first. Yeah, we were hoping our campaign for retirement at 60 would bring men into that 60, but no, the government decided women would go up to 65. That's the way it is, but we never give up. We certainly see the reasons behind the fact that if you stop the increase of, you know, state pension retirement age, then you give an opportunity for younger people that have been so devastated by COVID, a lot of them out of work in the hospitality industry, in the retail industry, all of that. It gives them an opportunity and an opening. Yeah. And you would think that this government would want to do that, but it doesn't seem to be in their remit. So we have to keep going. And I think for us, Gail, I'm really pleased that the General Council found our presentation really worthwhile. And perhaps maybe later on in the year, we can come back with some more policies that affect your working age members. And we can use those policies, you know, for the intergenerational good, I think. And we are doing an intergenerational Unite the Generations last session at the back end of June. And we've got a young person from the RMT who speaks very eloquently about how we join the generations together. So there's a lot to be doing, and I thank you for your time today.
It's really my pleasure, Jan, and you know, you're making about joblessness, you know, physicality, longevity, life expectation. It's all in the mix, is it not? The harshest treated are the working classes.
Yeah.
And you know, that really speaks to us as a TUC and to us in Unite. And again, you know, keep going, never give up. And thank you so very much to you and Ron for your hospitality.
Thank you, Carl.
Inviting me, and I should be joining the NPC ranks.
We'll look forward to welcoming you, Gail. Thank you very much.
Thank you so much.
Yeah. I'll just do a quick roundup now of where we go from here. This is our rally, which we would have actually had after a march in Southport. Might have been a nice sunny day, but never mind, never find out. So today's been the start of it. Our next session will be on the 18th of June, which is about equality and pensions. And Jack Jones from the TUC Pensions Officer will be there, Bob Pinkerton, who is a supporter of NPC long-term, but also a bit of a pensions guru. And we have, is it the Equality Trust or the Women's Budget Group? Yeah. Also looking at how we can make sure that women get a better deal when they become pensioners. The next session after that will be the 21st of June, which is around the NHS and care. And we have Professor Sir Michael Marmot with us on that one, along with Tracy Jarrett from Lewisham Pensioners Forum and Kat Hobbs from We Own It on the latest update on NHS reform bill, which we think will open the back door to more privatisation of the NHS. Our final session, as I said, will be about uniting the generations. We have speakers that, I don't know if anybody actually watched the programme, Old People's Home for 4-year-olds. It was a series of about four or five programmes. And it was a care home in Bristol, I think, with a input from 4-year-olds from a local nursery. Since then, the person who actually promoted that programme has actually opened up a nursery inside a care home. So that will be interesting to see. We also have an organisation who works right across the board on intergenerational issues. We have James from RMT, who is a young member, is the son of the new General Secretary, I believe, Ron.
Yes, it is.
Yeah. And just so that we can do something quite quirky and quite different, and hopefully send you all away saying, yay, that was good to do. We have Joy, who is a pensioner and took up rapping and battling against young people. So that will be interesting. She has a story to tell and it will be interesting, but that will kind of end our event, if you like, on the day on the 29th of June. So all I'm going to say now is thank you to everybody for being here. I hope to see you again in our next sessions. Please go to the crowdfunder. Yeah, we're halfway through what we need to fund by the end of the week. So please, whatever you can give and whatever you can get your family to give, your friends, your neighbours, anyone that you know, right? We need to do this and we need to make sure that the money is there. So look, you know, come on guys, we can do this, yeah? So thank you very much.
Thank you, Jan. I can only echo those comments made, and I also welcome the input from the speakers today. I hope you found the seminar or convention very convenient and enjoyable. And please join us on future dates that Jan has indicated. And obviously, you're always welcome to join the NPC if you're that age profile. There's plenty of room, and we always welcome new faces and people who are fighting the same cause. So thank you, and I close the meeting now and hope to see you on the next meeting. Thanks very much.